All right, today we are diving into a topic that a lot of people have asked me about, which is, will TRT or testosterone replacement therapy make you lose your hair? I'm James Grage, and I'm gonna help you answer that question with the help of some top experts in the field, as well as cover how and why we lose our hair and some of the things that we can do to potentially reduce the risk. Look, we all know the benefits of TRT, including increased strength, muscle mass, libido, virility, that motivation to go out there and get shit done. But depending on certain factors, there's obviously an increased risk for some of us with hair loss. In this video, we're gonna talk about those factors, as well as share some of my own personal experiences, as well as my personal regimen, how I keep my hair while using TRT, so make sure you stick around. All right, so let's talk about the basics of hair growth, which starts with a hair follicle. Let's pretend that's a hair follicle with a hair growing out of it. Every hair follicle has hormone receptors, and hormones like testosterone, DHT, estrogen, all influence hair growth, including hair growth patterns between men and women, which is why men end up with beards and women don't, except when women take male androgens, and next thing you know, you end up with a bearded lady. Now, these hormones regulate the growth cycles of the hair, so that's going to include a growth phase, there's a rest phase, there's also a shedding phase. So we talk about hair loss, but the reality is even a normal, healthy person loses hair. As a matter of fact, in this phase right here, a person can lose 50 to 100 hairs a day. It's normal, it's part of the cycle. We grow hair, we lose hair. The difference is how well do we grow new hair? For us men, the technical term for losing our hair is hereditary androgenic alopecia. So alopecia is just hair loss. So what this simply means is that you have a genetic predisposition to losing our hair because of a sensitivity to the androgen DHT, which is dihydrotestosterone. Now, DHT is a very powerful androgen and is crucial for everything that we consider being manly. So a deeper voice, more muscle mass, facial hair, that desire to go out, to hunt, to conquer, to fly your flag. So needless to say, some DHT is very important. Now, our bodies naturally convert testosterone to DHT through an enzyme that you've probably heard of before because of its association with hair loss. So that enzyme that acts right here is called 5-alpha reductase. And I want you to remember that because this is important, and we're going to come back to this in a second. Now, even though DHT is critical to a man being a man, some men naturally have a sensitivity to DHT, which causes the hair follicle to shrink. And as you know, shrinkage is a bad thing. So as this hair follicle continues to shrink smaller and smaller, so does the actual hair within the follicle gets thinner and thinner and thinner until one day it's gone. And to make matters worse, this sensitivity to DHT can also shorten this growth cycle and lengthen the rest cycle, and then pretty soon you're starting to shed more hair than you're growing. So that's the basics of what we call male pattern baldness or hair loss. Now, there are some other things to consider that we'll talk about here in a second, but let's get down to the part that you really want to know about, which is, will TRT make you lose your hair? And the short answer is maybe, maybe not, depending on a few things. Now, you have to remember that these hormones affect us all differently. For example, you could take two guys that have the exact same testosterone levels naturally, and one of them may have more of a genetic tendency to build more muscle than the other guy. So you give both of them TRT, it's probably only going to enhance their genetic tendencies. Now, the same thing holds true with hair loss. If someone has a genetic tendency to be more sensitive to DHT, then going on TRT is probably going to enhance that. So genetics do play a part. Now, another factor is going to be testosterone dosing. Now, let's face it, for every guy, it's going to be tempting to go with a little bit higher dose, to feel a little bit stronger, to build a little bit more muscle mass, to feel a little more energy, want to go out there and kick ass in the world. But you have to remember the other side. So it's important to remember, the higher the testosterone, the higher the DHT, the higher the risk of hair loss, also higher risk of prostate issues. So unless you want your doctor sticking his big fat finger up your poop chute, then that's another good reason to make sure that a qualified physician is monitoring your testosterone levels and other blood markers. Now, besides monitoring your total testosterone levels, there is one more thing that you can do with dosing, and that is going to be how you split it up during the week. So this is total testosterone levels, and this is 7 days over the course of a week. So if you take it once a week, levels rise and then levels fall, and this is your peak. You can split up the dose, same exact dose, but split it up into 2 equal doses. I'll talk about my personal regimen here at the end of the video, but you can split up on 2 different doses, and that way you're getting a smaller peak here, comes down, smaller peak, and comes back down. So smaller peaks in testosterone means smaller peak in DHT levels. So keeping our total testosterone levels in check is one way to manage DHT levels, but there is another way to manage that's completely separate. Now remember, we talked about the enzyme 5-alpha reductase, which is what is helping convert testosterone to DHT. So there are ways that we can attack 5-alpha reductase with what we call DHT blockers. Not very technical term. The more technical term is going to be 5-alpha reductase inhibitors. So there's some natural supplements that you can take that are DHT blockers. One of those is zinc. Another one is a supplement saw palmetto. Now, in my opinion, I think these are a great place to start if you're not already experiencing any kind of hair loss. But if you're already starting to see thinning of the hair, you might want to go the prescription route. Now, anyone who's heard of the hair loss drug Propecia, that is the chemical finasteride. Now, finasteride is a prescription 5-alpha reductase inhibitor. Now, you can take finasteride 2 different forms. There's a pill version, that is the more traditional approach. Then there's also the topical versions of finasteride. Now, what is one of the risks of taking finasteride? Well, because it's a powerful 5-alpha reductase inhibitor, sometimes it can lower DHT levels too much. Remember, DHT is what makes a man a man. So if we lower it too much, then you're losing some of the best benefits of taking testosterone replacement therapy. Now, the pill version of finasteride works on your whole body, and because it is a very powerful DHT blocker, it can actually cause some unwanted side effects, including lowering your libido, causing erectile dysfunction, which nobody wants. So the topical version is going to work just locally at the scalp as opposed to the whole body, and helping block DHT at the hair follicle, and can help reduce some of those unwanted side effects. Now, unfortunately, some of us guys start to lose our hair in our late teens, even our early 20s. But for the rest of us, approximately 50% of us, start to see noticeably thinner hair or hair loss by age 50. By the time we get to age 60, that jumps up to almost 70%. So this year, I'm turning the big 5-0, and I'm starting to see a little bit of thinning here in the hairline. So recently, I started taking a topical finasteride, and I'm gonna share my regimen with you. Before I do, let me clear the board real quick. All right, not to bombard you with too much information, but there are two other factors when it comes to hormones affecting your hair loss or hair growth. One is going to be your thyroid hormones. That's going to be your T3 and your T4. Both of those bind to the receptor at the hair follicle. When you have issues with your thyroid hormones, that can lead to hair loss. So when you go see your physician, make sure they check your T3 and T4. Most of them do. Good news is they can help you with medications and balance those out. On the other side is going to be estrogen. Even as a dude, we've got estrogen in our system, but when we're taking TRT, too much testosterone can convert to estradiol, leading to higher estrogen levels. That can lead to things like nipple sensitivity, gyno, which is a buildup of breast tissue, so you end up with man boobs. We don't want that. Problem is, doctors used to prescribe an anti-aromatase, so it would block that conversion of testosterone to estradiol. The problem is, it works so well that estrogen levels drop. That can affect things like libido and also hair growth, because the estrogen helps balance out some of the unwanted effects of DHT. So, moral of the story, A, don't go too high with your testosterone levels. Go to your physician, make sure they're checking your blood work, and they can help you with all of that. All right, now that we covered all that, you hung in there with me, let's talk about my personal regimen. So this is what I would call a hair-friendly TRT protocol. First thing, I do have to say that I am very fortunate that I don't have any kind of hereditary issues, but with that being said, I am turning 50 years old and taking TRT, so I have to be conscientious about this. So, first thing, like we've been talking about all along, is making sure that our total dosage of testosterone is a little bit lower. Means lower DHT levels. We also don't have to mess with, anti-aromatase medications that ends up affecting estrogen, blah-de-da-de-da. So, it used to be that my dosage was a little lower 6 years ago when I first started. Through the years, it's had to creep up just slightly, but now I'm at 160 milligrams a week, which is about 0.8 cc's. Now, for the first 5 years, I just did this one time a week. It was convenient, it was easy. The last year, now that I'm creeping up on 50, starting to think about my hair a little bit more. So now I've split that dosage into two. So now I do 80 milligrams 2 times a week. And like we talked about before, now we've got much lower peaks and valleys there with our DHT. So that's managing it with the TRT. Like I said, not taking any other kind of anti-aromatase, but I have started taking finasteride. I didn't want the unwanted side effects of taking the pill form, so it's a topical. Actually, this is not an endorsement. It was just convenient to go to Hims. I think their website is, hims.com. Spoke with someone on the phone, gave me an online prescription. So they sent me a spray that is, I want to say, 0.3% finasteride, but it also includes minoxidil, I think I'm spelling that right, which is at 6%. So the finasteride is blocking the DHT, but the minoxidil is going to help increase the growth phase with the hair follicle. So I do this just one time a day. I do it at nighttime because it's a little bit sticky, makes your hair look a little greasy, so I prefer to do it at night while I sleep. Spray it on, rub it in thoroughly into the scalp. I also include some of the supplements we talked about, so the zinc and the saw palmetto in there. And then Hims also has a shampoo and conditioner. The shampoo, I believe, has the saw palmetto in it, so topical version of it. And I think the conditioner has things like niacin B3 in there, stimulate blood flow. Whether that works or not, I don't know, but at this point, I'm gonna throw it all in there and we'll see how it shakes out. So that is my complete hair-friendly TRT regimen. Like I said, managed to make it 50 years and still keep my hair, so I plan on keeping it for the rest of my life, even if I have to do a little bit extra work. So hopefully you found this information helpful. If you like the video, please go ahead, help a brother out. Hit like, subscribe, Turn on notifications if you want to see future videos like this, and I will see you next video.